Hi, this is Courtney, Lauren, Frank, and Isaiah, and today we're going to discuss emphysema, which is a form of chronic obstructive pulmonary disease. Emphysema is a chronic long-term form of lung disease. The alveoli, which promote oxygen exchange between the air and the bloodstream, are destroyed. In return, this will cause shortness of breath and loss of elasticity in the lungs. The alveolar walls break down and adjacent alveoli fuse together. Because of this, when you exhale, the damaged alveoli don't work properly and the old air becomes trapped, leaving no room for fresh, oxygen-rich air to enter. Risk factors for emphysema include smoking tobacco, marijuana, air pollutants, and manufacturing fumes. Cigarette smoking is the major risk factor for developing emphysema. 15 to 20% of 1 pack per day smokers and 25% of 2 pack per day smokers develop some form of COPD. Other risk factors include secondhand smoke, occupational exposure to dust and chemicals, and a genetic deficiency of the alpha-1 antitrypsin protein. Signs and symptoms of emphysema vary from mild to severe, and they include dyspnea, which is labored breathing, a chronic cough, wheezing, cyanosis, which is a bluish coloration of the skin, edema of the feet and ankles, fatigue, weight loss, headaches, especially in the morning, and the patient may develop barrel chest caused by enlargement of the lungs and chest wall. The onset of emphysema is gradual, which causes many people to go undiagnosed for long periods of time, leading to irreversible damage. When visiting your medical professional, they will take your medical history into account and perform a physical examination. Blood tests, such as a complete blood count and arterial blood gases, could be taken. Other diagnostic tests that may be performed are imaging tests such as a CT scan or an X-ray, pulmonary function tests, or a pulse oximeter. Lung function or pulmonary function tests measure how well the lungs are working. These tests measure how much air you can take into your lungs. Your doctor will then compare your measurements with people who are the same age, height, and sex as you to see if you're within a normal range. These tests also see how well your lungs deliver oxygen to your blood, the strength of your breathing muscles, and how much air you can blow out of your lungs, and how fast you can do it. Testing for deficiency of the alpha-1 antitrypsin protein is simple and very accurate. If your healthcare provider notices you do not have any obvious risk factors for emphysema but are experiencing symptoms, then they will order a blood draw or finger prick test. Spirometry is a common test used to assess how well your lungs are working by measuring how much air you can inhale, how much you exhale, and how quickly you can exhale. A chest X-ray would be a good method to rule out any other lung issues such as pneumonia rather than to directly diagnose emphysema. Also, there is a pulse oximetry, which involves the use of a small device attached to your fingertip. The oximeter measures the amount of oxygen in your blood. This could help doctors determine whether you need supplemental oxygen or not. Unfortunately, emphysema is an incurable chronic disease but can be treated in various ways. Forms of treatment include bronchodilators, inhaled steroids, supplemental oxygen, surgery to remove damaged tissue in lung or lungs, or a lung transplant. The main goal of treatment is to reduce symptoms and slow the progression of the disease to increase quality of life. Along with course of treatment, there are also ways to manage your emphysema. People diagnosed are advised to stop smoking if they do smoke, receive a yearly flu and a pneumonia shot due to being more susceptible, exercise and eat a nutritious and balanced diet, reduce their stress as much as possible, conserve energy, and use breathing treatments when it's necessary. Below are the sources we used when researching for this project. Thank you for listening.